Dr. Kuntz, how should we be describing SMA in an NBS identified infant and prior to treatment? Things have changed so much with having newborn screening and disease modifying treatments available.
Well, I think it's absolutely delightful that the natural history of spinal muscular atrophy in individuals after these disease-targeted treatments has changed so much that we can't use the same way to talk about our patients and our families with SMA. I'm sure that there will be ongoing work on this with a lot of validation and study, but I think for the moment we should just start by describing each child as beginning with their SMN2 backup copy number. So SMN2 is a gene, and the number of copies of that backup gene as the first part of the description, and then describe what their state is. And if they're a newborn, we could be clear about whether we think they have no symptoms and therefore their exam is pretty typical for a newborn, or whether they have any subtle signs discernible to somebody who's very, very critical at doing neurologic exams on newborns. But you already made mention of the fact that 3 to 5% of all individuals will not be picked up by newborn screening. So not just in the past when there wasn't newborn screening, but even from now and into the future, there will be individuals who will be picked up when they are symptomatic. So I think in addition to their backup copy number of SMN2, we should describe their state of their motor skills, what their state of mobility and ambulation is. And age at symptom onset or age at beginning treatment or specifying the treatment, something along those lines. I'm sure that will be refined over time. And all of these things together will give kind of a composite picture of the severity of the state of their spinal muscular atrophy.
And as you're saying, these are descriptors that are in process, in evolution, in the SMA community, both across the healthcare provider community as well as our SMA patient and caregiver community. So more to come on that.